Hi everyone, Dr. Nemechek here with another weekly viewers' questions answered. Just a quick reminder, hit the subscribe button so you can stay abreast of any of the new material we're putting up. All right, first one, for those patients who are suffering from brain fog, do your patients typically recover to their normal cognitive function? Yes, if they do what I ask them to do. You know, some people, though, if they take half as much fish oil as we recommend, they may not get better. But if you just do the basic protocol as it's outlined in our books, and for patients who come here, yeah, they do recover their normal cognitive function. Next, what's your opinion on POTS and hypovolemia, or the low blood volume? What's the cause? So POTS is postural orthostatic tachycardia syndrome. It's basically you can't get blood pressure into your brain correctly and your heart's going too fast. And hypovolemia means low volume or low blood volume. And so this hypovolemia would be, in its truest form, you're dehydrated. You're out in the desert, it's hot, dry, you're evaporating all this moisture out of your body and you aren't drinking enough. So you lose water, you don't have enough. Now, that's not what's going on here. With POTS, or orthostatic intolerance is another term for it. Your arteries and veins are these pipes that have to be a certain diameter to keep the pressure to your brain. What happens from the neurological injury here is the nervous system can't keep them quite as stiff as they should, and they dilate. So it's not that you don't have enough fluid, it's that your pipes are too big. Okay? Now, so subsequently there isn't enough fluid, but the primary problem is the nervous system. That's what's going on here. Okay? And it's very common from recurrent brain injuries, cumulative brain injury, long COVID is very common problem, having POTS. So, and you can fix it with our protocol. You just get the inflammation down and sustained long enough, the nervous system recovers. 3, what are the signs that may show that COVID has caused some damage and it's necessary to add the glutamine? Now, so glutamine, so COVID, in approximately 25% of the time, so per episode of COVID, you have a 25% chance of developing this damage, this kind of COVID leaky gut, which we call COVID enteropathy. And it is self-perpetuating, and it's looking like it can last for several years, okay? And it causes a massive, sustained release of abnormal inflammation throughout the body. This damages the body in all sorts of ways, but it might not cause symptoms in and of itself, all right? And so it could be, your symptoms might be you just hurt all over. Your joints and muscles hurt. You're weak. Okay, that could be a sign of this. What happens over that first year, often the autonomics start not working. People get more brain fog. They're lightheaded, more headaches, more anxious. That could be your symptom that this is happening. It could dramatically worsen blood sugar control. It can cause cirrhosis, heart failure, worsening kidney function, deteriorating osteoporosis, triggering relapses of well-controlled cancer. You can do all sorts of stuff. All those are secondary. The inflammation itself may not be causing a symptom. And so it's a high risk for a dangerous problem that is very cheap to fix and only takes 6 weeks. So if you had COVID and you're worried about this, you just take a level tablespoon of glutamine. That's 15 grams, okay? The capsules won't do it. You got to do the powder. 15 grams twice a day, 30 grams total. Put in a little juice or water and do that for 6 weeks. And in the vast majority of the cases, it's fixed, okay? If you don't think it's fixed, come and see me and we'll take care of the rest of it. But that's all there is to it. All right, next. Does this oral glutamine supplement increase excitatory glutamate molecule within the CNS? So within a neuron, glutamine can turn into glutamate, okay? The doctors and the naturopaths and whoever, they keep talking about this, don't know what they're talking about, okay? They need to go just read some basic physiology. Oral supplementation of glutamine does not increase glutamate in the brain. It just does not do it, period. I'm not going to go through it all. It's basic physiology. They need to just go look it up. And what they'll see is maybe in an autistic kid, you give them glutamine and they start acting a bit more erratic, maybe a little more aggressive and stuff like that. That's because it's triggering constipation. You got to deal with the constipation. That'll go away. It has nothing to do with glutamate. Okay? The people who keep promoting this are going to cause other people to suffer needlessly. All right. My son is very picky and notices if I put anything in his food or drink. How can I incorporate this protocol into his diet? You just got to tough it up. You got to win. I mean, if your child had epilepsy and he needed this medicine to prevent him from having a seizure on the living room floor, if he said, I don't like the taste of this, you're not going to give it to him? You're going to give it to him. Okay? If you're using my protocol in a child, that's because they got some serious problems. We aren't just trying to make tomorrow better. We're trying to change the next 70 years of their lives. You got to toughen up. You got to win. Some parents just put it all in a syringe and in the mouth. Okay? And you may have 50 battles, but you got to win 50 in a row, and then on that 51st, they'll relent. Okay? There's no other answer. I'm sorry. Okay? And last, what can I do to rebuild my gut biome? I guess I'm full of bad news today. Nothing. Okay? You can't. And you may not even need to, really. So there's all this talk about, like when people talk about damage to the biome, it's like losing species, okay? And from antibiotics and whatnot. I get all that. But you can't just ingest species and think they're going to kind of like reseeding your lawn and it's going to stay. It doesn't work that way. First and foremost is your stomach acid is designed to destroy all living organisms in the stuff you swallow, okay? So if you have like some fermented foods with, bacteria or yeast in there, those bacteria and yeast are destroyed in your stomach. Okay, so it's not doing what you think it's doing. But say you have a probiotic that can get past that. It's special encapsulation or something. So as you take it, you'll have this extra bacteria there. But we now know once you stop, for the vast majority of cases, it just disappears. It doesn't hang around. Okay? It doesn't work that way. People are like, well, why? That doesn't make sense. No, it does. That's the science. That's what makes sense. It's just that people have some fanciful idea about this. The only way you can increase the number of species that will in your gut that will stay is through a fecal transplant, or what's basically simply called a poop enema. That's it. Now, most people, it doesn't benefit you at all. The only people where that's a benefit is if you have recurrent Clostridial difficile. C. diff causes enterocolitis, and it will kill you if it's not controlled. So these people that have highly recurrent or treatment-resistant enterocolitis, you give them a fecal transplant, dramatic improvement in those people. Outside of that, doesn't really help. All right, that's all for today's viewers' questions. Everybody, take care of your kids, take care of yourself, keep your inflammation down, and I'll see you next week.